All right, I think we have a couple more minutes before we officially start. So I'll get my script ready to go as well.
You can't see the waiting room, can you?
I can.
You can?
Yes.
Oh no.
You're not able to see it, Rachel?
No, I can. I mean, like on the screen, like I didn't want the little black box.
I see. No, I cannot. No,
Okay.
I thought you meant if I had
Sorry.
access to it.
No, I can see them. I'm about to let everybody in less than a minute here.
Okay, sounds good. Awesome. Everyone's coming into the room. This is great. Just a couple more minutes before we get started. All right, it is now 2 p.m. Eastern Standard Time on the dot, 11 a.m. Pacific Standard Time. Thank you so much for joining us. Today is our second session of the NCUIH Peer-to-Peer Solutions Center Office Hours, Chaha'oh, or Gathering of the People. My name is Divya Nanduri. I'm a Technical Assistance Manager with the Technical Assistance and Research Center, also known as TARC at NCUIH. And joining me from the NCUIH team are Kayla Emmerich and Rachel. So thank you both for helping me out today. And we are definitely honored to have you all here as well. We kindly ask that you place your name, organization, tribal affiliation, and title into the chat box. And in addition, we welcome any feedback you would like to provide about your webinar experience in our survey today, which is also posted in our chat box as well. Next slide, please. Oops. All right. And so we would like to thank you for volunteering your time today to participate in today's discussion. We here at NCUIH appreciate your willingness to share your UIO experiences on the HIV/AIDS work you all do in your communities, as well as interact with our wonderful presenters, which are upcoming soon. We do understand that this can be, HIV/AIDS is a sensitive topic, but it's also important as well. And we want to emphasize that this place is a safe space for you to share as much as you feel comfortable sharing. There are no right or wrong answers and, or comments, and we know everyone is in a different place with the capacity that they have with the HIV/AIDS experiences and programming. And this is just a space and a chance for you all to learn from each other as well as from our wonderful SME experts. And as shown in the agenda here, we're just going to start off with a overview of what the Chaha'oh is, followed by introductions of our presenters, a brief highlight presentation of the wonderful things that the Northwest Portland Area Indian Health Board is doing, a fun activity along with an open discussion that goes along with that, and then we'll close the session promptly at 3 p.m. Eastern Standard Time. Next slide, please. So just want to bring your attention to a brief disclaimer that this event is also made possible by the Minority HIV/AIDS Fund through the Indian Health Service. Next slide, please. And for those of you that are unfamiliar with NCUIH, here's a little bit of a background. The National Council of Urban Indian Health, also known as NCUIH, is the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. NCUIH is the only national representative of the 41 Title V Urban Indian Organizations, or our UIOs, under the Indian Health Service in the Indian Healthcare Improvement Act, or IHBA. NCUIH strives to improve the health of over 70% of the AIAN population that lives in urban areas, supported by quality, accessible healthcare centers. Next slide, please. So as we dive into our session, here are a few things to keep in mind. Your cameras are off and the mics are muted, but please, if you do have video capability, enable your camera, as this helps to create more of an interactive environment. And we'll be posting a background for you all to utilize to be a part of this Chaha'oh as we dive further into the session. So you can also utilize the raise hand function if you do have a question, which is at the bottom of your Zoom screen. If you would like to be called on, or if there's a brief silence, you can definitely just unmute and pop in with your questions or comments as well. Our chat box will be monitored as well. So if you would like to ask any questions, please feel free to do so, dropping any questions or comments there, and we will address them at the designated time. And if you haven't done so already, please be sure to enter your name, title, organization, and tribal affiliation into the chat box if you have not done so at this time. Next slide, please. And please note that the session is being recorded for educational and quality improvement purposes. And if you do have any technical issues during today's session, please place your query in the chat and a NCUIH staff member will assist you. And please make sure you come to our two future peer-to-peer Solution Center sessions, which are occurring next year on February 1st and March 1st. And if you also could provide us your feedback again, you can scan this QR code that you see on your slide or access the link that was placed in the chat. And you have an exciting chance to win a NCUIH token of gratitude if you attend all 4 sessions. So we had a session back in October, this one, and then 2 more next year. So if you attend all 4 sessions and complete the evaluations, you get a little prize. Next slide, please. So what is Chaha'oh? So we had a wonderful presenter and cultural guide from our staff, Evie Maho, to briefly explain this in the last session. And it's the Navajo word for shade, shadow, or sun shelter. And, you know, again, I'm not going to go over everything with this, but, you know, it's just, you know, it's the only remaining Puebloan vestige on a construction technique once commonly used in the building of pit houses. And so Chaha'oh is really finished because it requires constant care, and it is a warm, inviting place to gather, socialize, listen, laugh, and cook. And that's what we want to provide here for all of our wonderful participants, a warm gathering place for us to just have these discussions, a safe space for us to be able to listen to each other and just, have a space to be open with each other. And we have a video that we have a link to as well if you would like to get more information about the Chaha'oh. And this is told from the perspective of a Navajo grandma, so she'll definitely tell the story better than I can here. So please access that and watch it if you would like. And we will also be placing the link to a background image, as you can see some of our staff have, of a Chaha'oh if you would like to join us under the shade. Next slide, please. That is the link, which will be placed in the chat. Awesome. And now I will introduce our wonderful presenters for this session, Stephanie Krag-Rushing and Michelle Singer. So Stephanie is a principal investigator at the Northwest Portland Area Indian Health Board's Tribal Epicenter. Her work focuses on designing and evaluating multimedia resources to improve adolescent health using mixed media methods, community-based participatory research studies. And she has completed her Master of Public Health at Boston University and her PhD in Public Administration and Policy at Portland State University. Next slide, please. And we have Michelle Singer, who is the Healthy Native Youth Project Red Talon project manager and is a part of the adolescent health team at the Northwest Portland Area Indian Health Board. She provides technical assistance training and coordinates a national network of tribal partners in American Indian Alaska Native adolescent health. And Michelle's professional experience spans over 30 years of experience in education, research, government affairs, and community engagement in Indian country and Alaska. So I will now turn the floor over to our wonderful presenters. Please welcome them by placing a heart emoji in the chat or a heart reaction. All right, thank you both.
Thank you. So I will kick us off and then pass it over to Michelle in a little bit. But thank you for the warm introduction and the invite to be here today. Project Red Talon is actually the longest funded health project at the Northwest Portland Area Indian Health Board. So our Northwest tribes have been interested in supporting HIV prevention work for a really long time. We are housed at the Northwest Portland Area Indian Health Board and serve the 43 federally recognized tribes in Oregon, Washington, Idaho, and work within the board's epidemiology center. So like all of you, we are data-driven folks. And several years ago, worked on adolescent health action plans and action plans focused on specific health topics like We had an HIV and STI action plan. We had a drug and alcohol action plan, a suicide prevention action plan, and we recognized as we were building out these plans that the same activities and protective factors were involved in all of the action plans, that really building and supporting healthy networks for youth were the underlying goal of all of our plans. And so rather than focusing on individual topic areas, we expanded that work to focus on adolescent health in general. So we have an adolescent health action plan that was co-written with our Northwest Tribal Youth Delegates. And this is the plan that we've been working on the last few years, though I see we're getting close to time to update. These action plans are always moving along. Next slide. The action plan is inclusive of physical, social, spiritual, and mental health, and really is the guiding body that supports the work that we do, building healthy relationships and nurturing healthy outlooks and self-esteem, connections to culture. So it's very comprehensive in its scope and inclusive of sexual health topics like HIV and STIs. Next slide. To do that work, we've split our sort of communication strategies into 3 different domains. So Michelle oversees the arm that focuses on teachers and educators and caring adults. The Healthy Native Youth website really is the tool that we've built to house culturally relevant health curricula and lesson plans, and we'll talk about that today. We also have an arm of our work that focuses on teens and young adults themselves. So the We Are Native website is a resource for Native youth by Native youth and includes health topics, including sexual health, sexual identity. We'll share some of those slides as well, and our social media channels to kind of connect youth back to the health resources that are on the website. And then most recently, we've started working on tools and resources for parents and caring adults, sort of recognizing that if youth are getting access to sexual health information in the classrooms, it's important to also support the adults at home who are talking about these sensitive topics and may not feel immediately comfortable talking about those. So we'll share some resources that we've been working on to support parent-child communication around all of these sensitive topics as well. So that's kind of the background and strategy that we've used to communicate and get our messages out to various audiences. And then we'll share next what those look like in action. I'll pass it over to Michelle. Next slide.
Great. Thank you so much, Steph. Yeah, as you'll see, we're going to be on a journey. Good morning from Portland, Oregon, by the way. My name is Michelle Singer, and I use she, her pronouns, and I'm a citizen of the Navajo Nation. So Yat Ehabena to all of those Navajos out there. And yeah, Steffi and I have the great pleasure of working with the Healthy Native Youth Project and a variety of different national stakeholders, as well as our own allies within the Northwest Portland Area Indian Health Board, to leverage our cross-cutting programs to elevate the issues of HIV, AIDS, STIs, substance use disorder, and other issues that are facing our Native communities on and off the reservation, but of course across all age demographics as well. Next slide, please. As Stephanie mentioned about Project Red Talon, Project Red Talon goes hand in hand with Healthy Native Youth. Project Red Talon is very focused on HIV, STIs, HCVs, and other particular health issues that are facing our communities. And of course, as we mentioned, we have a a focus on adolescents, American Indian Alaskan Native youth, young adults, so college age, but also to the people who are around them, who engage them, whether it be in school settings, after school settings, at school and community health centers, different programming, and as well as families and relatives. So we try to offer a broad range of entry points for the opportunities for health promotion, health education, elevating the visibility of the issues through communications and other tools and resources that we're happy to share with you this morning. So next slide, please. And of course, we do know all of you lovely folks are working in the urban Indian community. So way to go. Shout out to you all. We love our NARA Northwest, which is one of the UIOs here out of the Pacific Northwest. But our work has focus within the Pacific Northwest, but we do have a reach across the United States, so Indian country and in Alaska. And we're proud to be able to work in partnership with our partners across the country. Next slide, please. And what we are excited about is we have a national network of partners known as Project Red Talon. As you'll see here, this wonderful representation of this slide covering different regions of the United States and their impacts, their reach in their training, technical assistance. As you see here, all the way from Alaska down to Phoenix, Arizona, in the Southwest region with the Intertribal Council of Arizona, to the Center for Indigenous Health out of the East Coast, out of Baltimore, to Southern Plains Tribal Health Board out of the Southern Plains region, Oklahoma, and that region, University of Texas Health. At Houston, their School of Public Health, their Prevention Research Center, and then of course our region, which we coordinate very proudly, and you'll see we have partners as well too. This slide represents all the amazing ongoing efforts and different aspects to elevate the issues of addressing, ending the HIV/AIDS epidemic in an Indigenous, culturally relevant framework amongst American Indian, Alaskan Native citizens, including our youth. And we'll talk a little bit more about this as we go on. Next slide, please. And there's also a handout that will be shared as a follow-up of a one-pager touching base on the resources, the tools, as well as the individual partners' efforts that we will outlay here today. But really the hub of our effort is the Healthy Native Youth website. It is a one-stop shop educator portal for adults, for caring adults, educators, community health providers, to parents, to relatives. It has a little bit of something for everyone. And this is an adult engaging interface website that contains an array of culturally relevant, age-appropriate health promotion around topics of in adolescent health. Our primary focus is around sexual and reproductive health, which includes HIV, AIDS, STIs, HCV, and in that particular regard, in addition to the cadre, a variety of different issues that go along with that. And so we encourage you to take a look at this website. And as you'll see here, we have tools for implementation. We've got the curricula, 16 of them. I believe 14 of them are free. So all you need to do is go in and download, and it's like a recipe book. You just follow the trail, follow the recipe, and watch the magic happen. We have tools for parents, text messaging campaigns, which we will share. We have a community of practice, very similar to this particular gathering here. And then, of course, an array of resources. Next slide, please. We have our implementation toolbox, which our partnership, Project Red Talon partnership pulled together led by the University of Texas, Houston, in concert with the Northwest Portland Area Indian Health Board, ITCA, and THC, because what we kept hearing, and we might hear your feedback later, is from the field, from the community. Where do we start? We've got issues. We need to know what to do. We've got interests. We're hearing this from families or from youth. You know, we don't know where to start. We don't know what to teach, or maybe we have a great effort going and we want to grow it. So we decided to create an implementation toolbox, which is excellent for a community setting, whether it's in Boston or it's in Phoenix or it's in Alaska, or in Nashville. You know, we have tools for you that will easily can be adopted and adapted to fit your community based on what your needs are. So you will see we use Digi icons for the journey, from the starting point all the way through preparing implementation to growing your program. Next slide, please. This is a best kept secret. These particular tools, phases, and steps can be used for any particular type of program planning on the ground. Everything from community needs assessment to choosing what aligns with the goals and the community's feedback, which includes both elders as well as youth. And this whole process, their voices need to be heard. Preparing how to go about doing this from A to Z successfully with confidence and community mobilization, implementing, which is one of the best parts of this whole process, because you really begin to see growth of not only knowledge, skill, and abilities and effectiveness from everything from the youth to the educator, to the school, to the community, to the families. And then you grow and you start over, just like in that circle. And this is what was pulled together based on a community needs, I should say, excuse me, community experience coming from the frontline educators, which include community health nurses, to health and education teachers, to parents and caring adults who knew that there needed to be something structured that they could use and share and bring back to their communities and utilize. And that's what the implementation toolbox does. Next slide, please. And within that toolbox, there are tools in there, ready to use templates, tips, resources that align, be helpful to guide an individual along their journey. This is a snapshot of our curricula and lessons page. This is awesome. It is a platter of curricula. We're just showing 3 here. These are tried and true. Native Stand 2.0 is your comprehensive A to Z curricula for high school age youth, with a very robust lessons that include HIV, AIDS, STIs, healthy relationships, consent, condom use, etc. You name it, it's in there. Native It's Your Game 2.0 is an updated curricula, multimedia that's used for middle school aged youth. And we, again, these are all culturally relevant curricula that instills the values and is presented in a way that youth resonate with, they gravitate to, and certainly community and parents and families truly are always amazed and impressed about the curricula that we have on our website and that are being implemented in the communities. And so we encourage you to take a look at our website. Next slide, please. This is a snapshot of our Native It's Your Game 2.0. This is, again, we do see many of our tribes, but also in our urban centers who have access to computers in a classroom setting, can be utilizing this in their classrooms or after-school programs. This is a web-based curricula that focuses on HIV, STI, and early pregnancy prevention curricula for Native youth ages 12 to 14. This is a really fun technological curricula that is free, that can be utilized in a very flexible environment. And again, tailored activities, handouts, journaling activities that focus on HIV, AIDS, STIs, and we're continuing to refine some of these curricula to modernize some of them into the modern era. But I encourage you, take a look. And as you see on these, on each of the curricula pages, it tells a little bit about the program. If there's any training involved, which many of them does not require training, but we do have orientation webinars, lesson plans, supporting materials, cultural relevance and evaluation and references are really important because there's a lot of communities or sites who want to implement, want to know, are these evidence-based practice? Is this a promising practice? Can we utilize this as a part of our grant or in our center? And we encourage you to take a look. And the answer is yes, you can do it. Next slide, please. This is just a snapshot of Native At Your Game 2.0 curricula. Again, free, downloadable on the Healthy Native Youth website. We have some of our UT partners on joining us today. Shout out to them. Always happy to offer any technical assistance and training on this. And I just want to point out, when you look at this slide, of course, youth are going to see, what can I identify with? Is this something that looks like my community? And the answer is yes. And what's great is you see the two elders at the very top. This curricula opens up with the elder blessing, a welcoming. It's letting youth and the community know that it is important for us to take on the role and responsibility as family and community, culturally speaking, to teach our young people, to teach ourselves, and to keep that continuing education all throughout this process, even on the sensitive topics. And so I just think this is the coolest curricula, and I encourage you all to think about this in your partnerships with entities that work with Native middle school youth. Next slide, please. And we also have standalone lessons. So under the standalone lessons tab of the curricula page, we have a whole cadre of lessons that can be offered, especially like now, getting ready for the holiday break, spring break, maybe you've got a retreat, what have you. Wonderful lesson. As you see here, we've got handouts for HIV AIDS. We have a condom demonstration and a video, dental dam. We also have other alcohol and drug misuse, a variety of different things. Consent, it's all together. We can talk about HIV, AIDS, HCV, SUD, STIs, but you also have to look at it, as Steph pointed out in the earlier slide, the medicine wheel concept, mind, body, spirit, all rooted in culture. And that's what we aim to offer. And again, these are free. They're timed out generally about 50 minutes each. So keep that in mind if you're doing any type of enrichment activities with community and or youth, or together, parents, elders, youth. Next slide. And this is most important. This is an amazing handout that we have free. This is a handout aimed towards youth. It's our youth support resources that we offer both on the Healthy Native Youth website. We also have it on We Are Native that Steph will touch on. This is important right now that we're promoting every day, all the time, but especially in the holiday season. It's a one-stop shop handout that touches on all the different health categories for resources and websites that youth and or parents or adults should know about, can bookmark, can refer. This should be visible in your health clinics, in your exam rooms, in your community health centers, or even in your publications or social media. It really is a wonderful opportunity for folks to know there is resources out there that are culturally tailored to assist communities. And of course, I'd like to highlight the sexual health piece in there, and we will touch base on that as we move forward. Next slide, please. So one of the things that we know and we'll hear more about is there is a fear out there, people, about talking about sexual health. It's a sensitive topic. Who talks about it? Who educates about it? Whose responsibility is it? And I can just tell you right now, the number one influencer in our youth's life is the parents, and in lieu of that parent, it's the relative or the grandparent. Taking that role back in a culturally appropriate way has always been with us as a people. So what do? We're utilizing technology. How many of you right now have a cell phone near you? And if you do, grab it. And I empower you to text the word empower to 94449. Go on your phone, hit the text, type in the number 94449, and then put in the word empower and hit send. And go on a journey with me about how to talk about sensitive topics with your youth. We encourage parents, we encourage caring adults, and this offers tips, tools, encouragement, coaching, in grabbing those moments with youth to talk about sensitive topics. Next slide, please. So we're utilizing technology in amazing ways to reach youth and meeting community in a way that's convenient, that's private, that's confidential, but it's direct. So we have a sister project, Paths Remembered Project, which is our Two-Spirit LGBTQ that addresses their health issues, their strengths, histories, etc. We have an amazing toolkit that's free called Celebrating Our Magic. Again, and everything that we're putting forth today has relevance to tips and tools and resources to talk about HIV, AIDS, STIs, HCV, but also too, there's resources, there's tips, and then education about it to break down that stigma, to break down that fear, and to provide action-oriented efforts with results, all at your fingertips. Next slide, please. So we encourage you to order a toolkit. So I will pass it over to Steph.
Thanks, Michelle. As she mentioned, we see this as sort of two halves of the same brain. The youth-focused work has been going on for a little bit longer. The We Are Native website was built about 10 years ago. So we get close to 20,000 hits on the website each month. And the website, since it launched, has had over 2 billion page views, which is really exciting. The website is really focused for youth to go into and access health information independently. So it covers a wide variety of topics, including healthy relationships and sexual health. Next slide. As Michelle was mentioning, we can order the materials to create safe spaces and posters to promote it. So we'll drop the link to order the campaign materials if you're interested in posting any of the safe space campaign materials in your community. Next slide. And we also use our social media channels to link youth back to the health topics that are on the website. So these are some of the posts that cover sexual health topics and bringing youth back to the website for more information about HIV or condom use. That masturbation social media got more hits than any post on our channels ever. That one really took off. Next slide. And our sisters and brothers up in Alaska built a very similar website called I Know Mine. So if you're based in Alaska, absolutely check out. And they have a really beautiful library of health articles and access to HIV testing kits and other materials specific to Alaska. So they're a wonderful resource for community members as well. Next slide. We also partner with I Want the Kit, and we have been building out access for communities to order self-testing kits for STIs. We know lots of folks aren't necessarily comfortable going into a clinic to ask for STI testing, and there is a really super easy way to order those materials free. The Alaska Native Tribal Health Consortium has built out that partnership for folks in Alaska, so folks there can order free test kits. And this part is something that we're really building on. This is kind of the next endeavor for our programming to make I Want the Kit available to Native communities and youth across the country, building access through other tribal epicenters and community centers. So if you're interested in kind of getting involved in that, let us know. We'll be trying to grow the network next year. Next slide. This is some of the media materials for those. So Southern Plains Health Board has been putting out really lovely materials for HIV testing, and folks can order free HIV test kits. Likewise, in the privacy of your own home. So that's a great resource that it's available nationwide. Feel free to share that information in your own settings. Next slide. So this is kind of the summary page for Michelle and I and how to find us, and feel free to connect. I know we're close to time, so I'll shift us back over to the facilitators today, but we're open to questions and excited to talk about opportunities. Our work is also funded by the Minority AIDS Initiative Fund, so we have funds through the same channels. Thank you.
Yeah, thank you so much. That was an awesome presentation for sure. And we appreciate you joining us today and providing us with that fabulous overview of all these wonderful resources and toolkits that you'll have developed. And obviously you have across on a national platform. So that's awesome. So we will now transition into our open discussion portion of the session. And first we'd like to start off with a Kahoot, which is an interactive game to help warm up our engaging discussion and let you all get comfortable to ask us questions. All right, so we will pop that up onto the screen. Yes. Oh, and this is the preview. So let's go back to the actual page and press the start. We don't want to give you a sneak peek. Yeah, but at this time, if you do have questions for Michelle or Stephanie, please place them in the chat or come off mute and get onto camera as well. We'd love to see your awesome faces, answer any questions or you know, even some comments about the wonderful resources that they've shared today.
I'd just like to add, we have some of our partners on, from the Southern Plains Tribal Health Board to the University of Texas at Houston, some of our good friends. And so, like I mentioned, if you have any questions about any of their programming, certainly Southern Plains does do the native test kit. So, and then of course our UT friends are with Native It's Your Game and the implementation toolbox.
Great, thank you so much. And welcome to you all as well. Awesome. So I have just placed the website link, or you can use the QR code with your mobile device to join, or you can join on your computer as well at kahoot.it and enter the game code, which is 6772868. Please don't be shy, join and have fun. Awesome. We see tons of people coming in. This is great. Someone is hungry. It's about that time, isn't it? Awesome. All right, we're going to give it about 30 more seconds and then we're going to get it rolling. So if you haven't joined yet, please do so. Yes, thank you, Alec, for placing that in the chat. Yes, you can join the game, later on. If you haven't joined yet, the code and everything shows up throughout the entirety of the presentation. Awesome. All right, so we will get started. And if those are still trying to join, you can feel free to join as we go through. All right, and we'll get started. So a quick poll. So just, for those of you that are in the room, please select your facility type. Again, no wrong answers here, just what you think your facility type is. Just so we get an idea of who is in this room. Awesome. Outreach and referral. Thank you so much. Next question. All right, and a quick quiz. So if you joined us at the beginning, what does Chaha'oh mean? Or if you joined us in our previous session, what does Chaha'oh mean? All right, y'all are paying attention. Yes, it is the shade house, shadow, or sun shelter. All right, next question. Oh, and we got to get our score. All right, Stephanie leading us. Awesome. All right, when is World AIDS Day? Just a curiosity here. When is World AIDS Day? It is December 1st, so just right around the corner. So all of these resources can be shared in commemoration with World AIDS Day. The rest of the dates, so March 20th is National Native HIV/AIDS Day, April 10th is National Youth HIV and AIDS Awareness Day, and June 2nd is National HIV Testing Day. So June 27th is National Native HIV Testing Day. So all of these are important dates to keep in mind, but December 1st is right around the corner. All right, next question. And who's on our scoreboard? Micah. Oh, all right. We got some flips and ups and downs. Awesome. Open-ended questions. What types of health education are being provided in your community? You have a minute to answer this. So our presenters, and we can get an idea of what's being, held in your community space.
And if I could add, yeah, that could be like in your health center. It could be in a nearby Boys and Girls Club, schools.
Exactly.
Yeah, think broadly.
Yes. Even if time finishes, we can definitely have an open discussion about this as well before moving on to the next question. So we're not going to leave it if there's no answers. All right, and let's show those answers. All right, implementation toolkit, sexual health resources for natives, as well as program implementers. And all right, curricula at the school, social media outreach presentations, youth program, and educational programs. Wow, awesome. Would anyone like to come off of mute? Okay, Tony has also put in the chat substance use. Thank you. And would anybody like to come off of chat and just kind of give a little more background of what they have? Oh, awesome.
This is Carrie out of Bishop, California.
Thanks, Carrie.
So we utilize a lot of the We Are Native, Healthy Native curriculum. I was once trained in Native Stand. We also work with California Rural Indian Health Board. They do a program, I believe it's called Tribal Prep. And it's similar to Native Stand, where it's just encouraging youth to participate in programming, typically throughout the summer, a couple of weeks long. where they have to come in and participate, and then they do receive education and an incentive.
Awesome. That is great. Thank you so much for sharing. Anyone else like to share? All right. Well, keep this in mind. We have a couple more questions going through. All right, quick poll. Are you aware of self-testing kits? Just to see. I mean, now you might be because of this presentation too. All right, well, looks like we have a lot. Okay, one person no. All right. That is awesome. All right, anyone? Okay, perfect. We have one person not sure. All right. So we do have the resources. Oh, go ahead.
I was just going to say, I share that I didn't know, but after the presentation, now I know. So
thanks, Evie, for the honesty. Yeah, no, this is a great space to learn about it, and like, you know, I'm sure that all the resources that NPAIHB has provided like are definitely going to be useful for you all to get to know more about these self-testing kits for sure.
Yeah, and I would add, this is the coolest thing. It's really great for youth to know, for families to know, for your patients or clients or in the community. We showed the Southern Plains Tribal Health Board's text messaging campaign. These can be for HIV, for STIs. It's as simple as ordering it with a text. I can go into the I Know Mine website and look at what their shop looks like and the different things. And all you need to do is either text the word to a short code or just order online. It's sent to the individual very discreetly and privately. And now that we've done COVID testing at home, I mean, everybody's learning how to do these things. And so it's a great way to detect, to prevent, to detect and treat. This is the movement. So explore it. Think about hitting up some of our friends who are here on the call. Katie Ritchie is here. She can definitely provide some information about their programming, but this is all the latest now. John Hopkins with I Want the Kit is really developing this cool opportunity for all of these areas that are free, and we'll be coordinating care and response.
Thank you. All right, we're gonna ask some more questions and get some more wonderful answers. So are you utilizing or aware of any TV ads related to HIV or health education in your communities? Have you seen these things? Answers came in quick. Ooh, all right. So about 2/3 have seen things like this. Would anybody like to elaborate on the types of things that they've seen, TV ads and whatnot? What have you seen? And you can place it in the chat if you're unable to come off mute as well. We will voice your opinion.
I like to share that I've seen medication ads more so, but not in my community, not Native American specific. So I think that's what's missing from, or there's no prevention ads, but rather just the treatment through medication. That's really a commercial ad.
Yeah. That's a good observation, Evie, for sure. Yeah, and we see in the chat as well that, yeah, Molly's agreeing that there are ads that are not Native specific, and Micah says she does see a lot of ads for PrEP. So there is some awareness out there, but we definitely need to make it a little more, inclusive and also specific as well. So great. Any other inputs? All right, we will move on to the next question then. All right, a little bit of a brainstorm. So what are the top 3 challenges you face in providing HIV/AIDS education or resources to your communities?
And I'd just like to add, we have free downloadable ads, playlists, things that can be shown in your waiting rooms, on your social media channels, on YouTube. We Are Native has a great selection, as well as Healthy Native Youth, our Indian Country Echo. Definitely hit us up, because and Good Health TV offers a lot of culturally relevant ads. So we've got you.
Great. See, and there's a solution to the challenge. Awesome. All right. All right. The community is sometimes hesitant to talk awareness and state health standards. All right. And would anyone like to come off and elaborate on their challenges that they've provided and get some solutions?
This is Gabrielle. So I put the state health standards. So I am a part of the Texas crew, in which Texas last year updated their health education standards for the first time in like 25 years. But it turned out that they were making our lives a little bit more harder. So just having to navigate around that, especially if we're in a school setting, and just, getting creative with how we can adhere to these standards, but also get the information out there.
Any feedback from our presenters, and we can definitely help you address that as well.
Well, I do work with Steph and Michelle.
Okay. Any feedback?
So I think that the text messaging systems that they have in place are really helpful.
Great.
Yeah.
Thank you for that, Gabrielle. Appreciate that. Yeah, no, that's an awesome way to help navigate different states, standards for sure, because every state is different, and we definitely want to be able to get the messaging out on a national level. So that's one way to go around it for sure. Awesome. Yes, and the topic is still sensitive, so it is sometimes hard to build confidence. That is true.
We've been working and being consulted by different states' departments of education, contacting us. Again, we refer them to the Healthy Native Youth website to take a look at our curricula. Does it meet state health standards in their education core principles? And those are now being adapted and adopted into school settings. We also do have some of our know of regions out of Southwest, for example, that's hosting roundtables, community roundtables, to talk about, why is there a hesitancy to talk about things? Is there still a fear or awareness? Are they knowledgeable on these issues and what's out there just like this? So always happy to offer some technical assistance in that way, or refer folks to you all on that. But the big part of it is acknowledging the fear, taking the power out of it, and letting the folks know that there are solutions. People are doing it. So
Agreed. All right, so we're going to skip the voting. And then, what messaging around HIV awareness have you found to resonate with urban Indian communities? So things that you have seen, and this could also be for tribal as well, if you do work with, a plethora of groups in that sense. So. All right, we have one answer, but if you'd also like to come off with mute, that would be great. So much to type, most likely. All right, let's reveal that answer. All right, comfort level, parental buy-in and student attendance, and director comfort level. Awesome. Would you like to elaborate on this answer a little bit?
That was mine for the last one. Mine froze up and just submitted my technical difficulties.
No worries.
So, what messaging around HIV awareness have you found to resonate with urban communities? Yeah, I was having technical difficulties, so I got skipped. Anyhow, what seems to resonate with our community and is just like protection and being aware that, you know, small communities, urban communities, it doesn't really matter. We still need to protect ourselves.
Agreed. Agreed. Thank you so much for sharing that. Would anyone else like to share if they have something that they've seen within their communities? Going once, going twice. All right, we're going to move on to the next, and we're going to wrap up pretty soon as well. As a quick poll, have you created or utilized urban Indian youth-focused education and prevention resources? And again, a lot were shared today as well, so if you haven't, now you can. All right, so majority no, about 40% said yes. So that's okay, because we do have, again, a lot shared today, and they will be shared post this session as well for you all to utilize. So no excuses. All right, next question. Again, open-ended. So just any general questions or comments you have about the Healthy Native Youth Program that you would like to share. And please feel free to do so in the Zoom chat as well if you don't have access or having this technical difficulties like Carrie did with the Kahoot. And if you can't think of any now, you know, you can definitely reach out to us and we can pass those questions on to Michelle and Stephanie too. Or you can reach out directly to them because we will be providing their contact information. Multiple ways to get your questions and queries answered. We have one, all right. All right, 2 answers. All right, let's reveal. All right, well, wonderful comments. Okay, thank you so much. Yes, great work, such cool resources for sure. And yes, this is an awesome presentation. Yes, wonderful, wonderful things coming through. All right, let's move on to the next. Anything about Project Red Talon? Another awesome project within this amazing presentation that was talked about. And we're going to wait about 30 seconds for this one. Oh, we have one. Twenty more seconds here. And again, comments are also welcome as well.
We're so informal. Feel free to unmute yourself. We'd love to hear your voice. Yeah, I feel like I'm on a game show.
All right, let's reveal. Awesome work, agreed. Yes, you all are doing the awesome work, and we're so happy that you're sharing that work with us. So thank you so much. And we will round out with our final open-ended question. Do you have any additional questions or comments? And while you're thinking about that, we do actually have a poll that we will pop up as well. If we could do that on the side, or actually I can do that. Let me launch this poll for you all, just some food for thought for our next session as we move through. Yeah, feel free to answer these questions, you know, so we can talk about these in our upcoming session as well. And we do have an additional question that came through in our Kahoot poll as well. All right, all right. Give it a few more minutes, or a few more seconds, not minutes. Oh my goodness. About 10 seconds left. Perfect, perfect. 3, 2, 1, and the big reveal. No questions from me. Thanks again. Awesome. Great way to round this out. All right, we're going to take us back to the presentation, and we see some questions or our poll being answered. So thank you all for that. So we can round out this wonderful session.
Well, we thank everybody for joining us. We applaud you, and we just thank you for this time. Always know that there's somebody doing this out there, so don't be afraid, don't be shy, lean on us, lean on one another, and we can change a nation.
Yeah, thank you so much, Michelle and Stephanie, both for this wonderful, wonderful presentation. Again, we appreciate any feedback that you'd like to provide about your session experience by either using that QR code that we have on the screen or the link to the chat in the chat box that will be provided as well. Next slide, please. And we also have if you have any queries or questions that you would like answered, we also provide one-on-one technical assistance as well. So you can submit your request at ncui.org/TA. That link will also be provided in the chat box. Next slide, please. And we do have some upcoming NCUI events. So again, our next session for the Peer-to-Peer Solutions Center will be on February 1st. So in the new year, that time is still to be determined. So please save this date. We do have a virtual dialogue on understanding and preventing missing and murdered Indigenous peoples, which is tomorrow from 1 to 2:30 p.m. Eastern Standard. And then we do have the Vaccine Equity Community of Learning Series Sessions 2, which is on December 14th, and Session 3, which is on January 11th. From 2 to 3 p.m. And then on Friday, January 20th, from 2 to 3 p.m., we have Thriving Beyond Survival, Advancing MMIP and MMIW UIO Programming. And finally, save the date for the NCUI 2023 Annual Conference, which will be from Monday to Thursday, May 15th through May 18th. And you can visit for more information at ncui.org/events to get those registration links as well. And all links and every toolkit that was shared here today will be provided to you all in a follow-up as well, along with that, any events that are occurring at NPAIHB through Healthy Native Youth and Project Red Talon. So thank you all for joining, and thank you so much, Michelle and Stephanie, for that wonderful presentation. All right, have a wonderful rest of your day, everyone. Thank you, thank you, thank you for joining.